Hi, and welcome back. This is Dr. Suchard again with a short supplement for Goldfrank's Chapter 69, focusing on serotonin syndrome. The objectives for this session are that you'll be able to describe the clinical features seen in patients with serotonin syndrome and to outline a treatment plan. Recalling back to prior material in this course, early on we had defined the term toxidrome and had noted that many of the classic toxidromes resulted from drug-induced alterations in neurotransmission. Well, there are other neurotransmitters than depicted on the previous slide, and there's another toxidrome called serotonin syndrome that can occur from excessive serotonergic neurotransmission. The figure here is showing serotonin, 5-hydroxytryptamine, an endogenous neurotransmitter involved in multiple functions, including mood. And we're covering this topic now, along with Chapter 69 in Goldfrank's about serotonin reuptake inhibitors and atypical antidepressants, because overdoses and drug interactions involving these medications are the most common causes of serotonin syndrome. Serotonin syndrome is a clinical diagnosis, in that there is no diagnostic test, no blood level or X-ray or EKG that confirms or proves the diagnosis. It's the overall clinical picture and exposure history that allows you to make the diagnosis. Serotonin syndrome presents clinically with three kinds of signs and symptoms: some degree of altered mental status, neuromuscular hyperactivity, and autonomic instability, which is to say abnormal vital signs. And this occurs most commonly as a drug interaction when the patient has been exposed to multiple proserotonergic agents. But it may also be seen in overdoses with a single proserotonergic drug. Depressed people may be on antidepressants. Many of those antidepressants are proserotonergic, and depressed people might overdose on their meds. Here's a figure from my favorite article about serotonin syndrome from the New England Journal of Medicine in 2005. The picture here is static, but the disease itself is rather more dynamic, which we'll see a bit later on in some video clips. But the figure does do a good job in showing a tremulous and agitated patient. We see neuromuscular effects that are worse in the lower extremities than in the upper extremities, with tremor, hyperreflexia, and clonus. Clonus is sustained rhythmic muscle contractions and relaxations, and this is going to be easier to understand when we see the video clips. Autonomic instability is typically seen with tachycardia, diaphoresis, sweating, increased GI motility, and with hyperthermia in more severe cases. Here's a table listing a number of medications associated with serotonin syndrome. And if you look at the rightmost column on the table, you'll see that they all increase serotonergic tone through various mechanisms. Serotonin syndrome is not an all-or-nothing phenomenon. It occurs along a spectrum of severity, and not every patient shows the same signs and symptoms. I believe mild serotonin syndrome probably occurs quite frequently, where the patient feels a bit anxious and jittery for maybe several hours, but it goes away without needing any treatment, and the patient maybe doesn't even tell anybody, let alone seek medical care. As serotonin syndrome gets worse, we see more neuromuscular hyperactivity, worsening CNS effects, and the development of hyperthermia. I know some toxicologists who don't even call it serotonin syndrome unless the patient is hyperthermic. I just said I believe milder cases exist and are probably common, but this is an issue of semantics. Does it even matter if we miss the diagnosis on such a mild case? Probably not. But I would agree that hyperthermia is a marker of when serotonin syndrome is serious and warrants more aggressive treatment. And maybe those are the only cases where it does really make a difference if we make the diagnosis. Now I'm going to be showing you a few video clips of patients with serotonin syndrome demonstrating many of its clinical features. These clips total about 4 minutes in duration. One of the original clips had almost no sound, so I inserted subtitles for that part.
since I last took Ativan. And starting again. I can talk. I can still move, but I'm shaking. I have my phone and my Ativan right next to me. Part 2. It's all over. I got my water. My body aches like I just ran 5 miles. I'm exhausted. I want to take a nap. So, in 4 hours, I'm going to have to take another Ativan. Or that's probably going to happen again. That wasn't actually that bad. Last night, my legs were going crazy. So it was a little better today. But where do I go from here? How long is this going to last? I don't know.
The treatment of serotonin syndrome is primarily supportive care. Many patients will be tachycardic, sweating, and may have diarrhea, and IV fluids will be good for that. If the patient is hyperthermic, cooling measures should be instituted, and sedation may be needed to control agitation. Typically, benzodiazepines are used for sedation, but I also included this treatment algorithm for the ICU that considers dexmedetomidine infusions too. There is a so-called antidote for serotonin syndrome, although that might be overstating the case. Cyproheptadine is an antihistamine that also has 5-HT1A and 5-HT2A receptor blocking properties, so it's a serotonin antagonist. Cyproheptadine is only available in a pill form, so the sickest patients that might benefit the most would be harder to treat. It might need to be crushed and given through an NG tube. Whereas if a patient could tolerate PO, they're probably not as sick, and maybe more typical doses of benzos, either IV or PO, are all they're going to need. By this time, the figure here showing the spectrum of serotonin syndrome severity and what management options are available should be old hat. Mild cases get mild treatment, and more severe cases get more intense treatment, and that treatment is primarily supportive. And if you like cartoony visual mnemonic devices, I've got that for you here too. I wonder where they came up with that image. And that's all I've got for you about serotonin syndrome. I'll be seeing you around.